Yeah, so here at SOHO, I was describing the experience of the International Consortium on Acute Leukemia, which is an initiative of the American Society of Hematology, ASH, and we have been developing a protocol for AML since 2015. To expand the AML therapy to resource-constrained area, one of the main things is to establish infrastructure. So we have been adapting, for example, NEGS-based classification of the disease using a restricted set of genomic analysis, as well as incorporating measurable residual disease by flow cytometry and molecular biology techniques in Brazil, Peru, Chile, Uruguay, and Paraguay. And we have been very successful doing that. It's doing through cooperation that we are doing both with well-established groups in America and in Europe. So one example of that is under the leadership of Dr. Peter Volk from the Erasmus University, we have been establishing these NGS techniques, one lab per country, and we exchange the results, both the analysis and also the crude data, and there is really a very good conformity of what we are obtaining there locally with the analyses that are also performed in the same samples at Rotterdam and Erasmus University. So with that, we were able to, for example, better identify truly favorable patients that can benefit from intensive chemotherapy. We are also working on other fronts, just like trying to decrease the mortality during induction, which is much higher in our reality than what is described in clinical trials done in Europe or in the US. And we have already succeeded to decrease this from something in the 25%, even 30%, to a rate about 15%, which is still higher than what we would like to, but indicate the progress as the protocol develops.